Hi everyone, this is Deepak Datta with DentaVacation. I'm very excited today to introduce Dr. Gaurav Malik, who is our brand new dental partner here in Chandigarh, India. Hi Dr. Malik, can we get to know more about you?
Hello Deepak. And hello everyone. I hope you're keeping the smile on. I'm Dr. Gaurav Malik, heading Director and Head of Max Dental Care Chandigarh, and I head a hospital-based comprehensive dental center with an exceptional team of specialists.
So, Dr. Malik, can we get to know why you chose dentistry as a career?
My actual inspiration has been my orthodontist. During my school days, I was not very happy with my smile. I felt I have bigger, longer teeth and they were not really aligned well. And I indeed used to feel pretty conscious, to smile and I used to be a little conscious even in social settings and avoid having pictures with a broader smile. So it's then, I felt pretty inspired when, I used to look at him changing lives, changing personalities, and that really motivated me. And that's where I decided to take up periodontics and oral implantology. And I developed a keen interest in especially oral implantology, and I made a lot of efforts to take it to the forefront. Our patient care philosophy is multi-pronged. If I look at the bigger picture, we have a set vision and mission, is what I want to call it, where we think that the highest level of skills is our primary focus, so that we have a complete skilled workforce, infrastructure to support all the skilled people, and at the same time the technology, so the innovations happening, to be in touch with what's coming up in our field, how things are changing. So these are three things through which we put our primary focus on the patient. So our philosophy is very, very patient-centric, and that patient-centric philosophy, we need to work on these three parameters which I've talked, to give them the best care. So in this best care, we make sure that we dedicate our entire skilled team right from the patient scheduling to making them understand the options they have. Those options are made understood by a lot of videos, a lot of information, verbal, scientific, so that they're able to make some informed decisions.
Okay.
So after they have made those informed decisions, we make sure they understand the timelines, they understand the financial structuring, they understand how the whole stepwise system works, and go to the minute details to treat them in a more holistic way, to understand every minute detail of their problem, their need, their expectations. And at the same time, we make sure that we compare those expectations and inform them about certain clinical limitations. So the expectations are to the point where science helps us to do and deal with them in a certain way. So that's the way we feel we build trust. That's the way we make sure that we keep that information for them confidential, and that's the whole philosophy where we feel we have more and more patients coming to us every time.
Okay. So what is that your dental center can provide which other dental clinics can't?
I would frame it in a simpler way and call it all under one roof. So we have strengths of the fact that we offer a wide range of comprehensive dental care covering all multi-specialities. Now when I say that, it simply means that not just the infrastructure way, not just the technology way, but we have an entire team of specialists from all branches. So if you look at dentistry, we have about 8 to 10 specialists. We have 5 graduates and the support staff to make our life very easy, not just as professionals, but it's a great offering to the patient. From there, we have certain accreditations which are almost difficult, and hardly anybody in the region has that. The NABH, which is a very equivalent to the JCI standards. In fact, we are already working on the JCI affiliations. So that makes things very accountable. It makes things very transparent, where we have to follow certain set protocols, where we have certain SOPs. We can't really go out of them, where we know, the kind of products and the kind of materials which we are using and what the patient is getting. If you're using a certain material or a certain implant, it is made sure that you're authenticated by a complete file, complete stickers. If there's a particular crown or a particular product, it is really authenticated into your files. Your billing happens accordingly. It's all computerized. We have a lot of embassies who endorse us. Rather, we are the only hospital which is on the list of the entire embassies in terms of their dental care. We are the only one who are taking care on all the medical checkups into the people who are immigrating to the US, to Europe, Australia. So we are already a preferred and I would say we have tie-ups with almost all of these people. So in that pursuit, we end up seeing, meeting and knowing a lot of international patients.
Dr. Malik, can we get to know any interesting story or any incident about any of your favorite patients?
Well, Deepak, if I think on, yes, I think I have few of my patients or the so-called success stories which really make you humble when you see the reward and see how they have changed their lives. I think the first one I like to mention here is one of the religious gurus in our region. We had to work on his complete trauma care, where he had broken about 8 of his facial bones. So it was literally about 6 plates which were like up to 18, 9 hole, 6 hole, and it was a massive surgery which went on for about 6 hours, and we could get his the whole facial structure back. Now the challenge came in of rehabilitation in terms of teeth. So it took us about another 9 months to rehabilitate him with complete implants, crown and bridge. And at this point, once we finished from where we started, not just we helped him get his whole entire face back, but we made him sure that he has all of his teeth. We gave him his 28th teeth based on implants, and he is totally fit, fine. We were challenged with the autistic kid. It was my pediatric team, Dr. Rohini and the entire team, where we took all the pre-anesthetic consultations. We looked at the safety parameters, and we got a go-ahead to take him under general anesthesia. And we gave him his 20 teeth back with entire root canals, a lot of crowns, and it was again one of the most rewarding experiences.
So, in addition to helping people get a beautiful smile, how else do you think a dentist could change people's life or impact the society?
At the outset, being a dental professional or any healthcare professional, we feel we have a direct contribution to the society in terms of their general health. So as we understand that health is a social, mental and a physical well-being. So a dental health becomes a very important and an integral part of your overall health. At this stage, I can proudly say that with the kind of profession or the kind of care I am in, we are really able to give a lot of hopeless people hope, and people who have lost the will to be able to eat again, people who have unfortunate traumas or accidents. We have a center where we rehabilitate them. People who have cancers, oral cancers, and unfortunately have to get away with the part of the jaws. We are there with our setups where we do rehabilitation for those patients. So I think the dimensions are huge in terms of contribution, and these are certain ways from basic care in terms of prevention to the complex treatment in terms of trauma and cancer rehabilitations. We feel we are able to make impact in the society and change people's lives, whatever in a bigger or a smaller way.
It would be nice to know how oral health of a person impacts their physical health. Can you educate us on that?
How it impacts, I can sit with you all day long and show you maybe thousands of published evidence-based data where they have related the oral infection directly impacting your cardiac health, your rheumatoid arthritis, preterm low birth weight babies, and now your periodontal condition or a bad periodontal status is considered to be the 6th causative factor for diabetes. Please kindly take care of your oral health. It really impacts your general health, which you might not realize at the younger years, but as you grow older, there are a lot of diseases and problems which could be directly related to your oral health.
Dr. Malik, appreciate you taking out time. Wish you the very best and look forward.
We want to be sure, and I want to tell all my audience that we want to make your experience truly phenomenal. We stand by that, and we look forward to collaborate with Deepak, the DentaVacation, and take things forward from here. Thank you so much.